So thank you to everyone for joining us on National Voter Registration Day for our latest State Liaison Network webinar, the State of the Society Policy Updates and Preparing for the 2024 Election. A few housekeeping items before we begin. We'd greatly appreciate it if you could keep yourself on mute unless you're asking a question. That way we can cut down on background noise during the webinar. Speaking of questions, while we do have a chunk of time allotted at the end for discussion, please don't hesitate to ask any questions you have during the presentation. And you can unmute yourself or pop a question in the chat. And finally, this webinar is being recorded, but we will stop the recording before our discussion so folks can speak freely. So my name is Samantha Berg, and I am the Manager of State Advocacy for the Society for Maternal-Fetal Medicine. And I'm also joined by my colleague, Becky Abbott, who is our Senior Director of Advocacy at the Society. SMFM is dedicated to advancing optimal and equitable perinatal outcomes for all who desire or experience pregnancy. And our work falls under three overlapping categories: advocacy and partnerships, member engagement and support, and knowledge, education, and research. Under our advocacy and partnerships bucket of work lives our State Liaison Network. So this is a member-led program that focuses on state-level advocacy and the implementation of state-based public health programs. We aim to harness the power of clinician leaders in each state to provide intelligence and serve as SMFM's ambassadors and advocates. And we have worked with our SLN members on a number of advocacy activities, including drafting legislative testimony, submitting reports and letters of support to legislatures, and more. And if you aren't a member of the State Liaison Network and you'd like to join, you can register at smfmadvocates.org/SLN. So here is our agenda for today. We're going to start with some federal and state policy updates before moving on to the 2024 election and our Get Out the Vote work. And then we'll have a really solid chunk of time at the end for a broader discussion on what you all are working on and how SMFM can support you. Again, we'll stop the recording at that time so you can speak freely. So now if you didn't have the opportunity when you first signed on to the webinar, I want everyone to take a minute to go to this Poll Everywhere link, which we'll be using a few times today throughout the webinar. So I'm just going to give it like 15 seconds for everyone to take out their phone and go to this link. All right, I think that's enough time, but if not, there is also a QR code on each slide. So I know we asked folks to put in where they're located in the chat, but for anybody just joining, we'd love to see what state you're practicing in. And so you can go to that QR code and just click on your state in the map. We either have 13 people in Texas or everyone's still getting the map to load. There we go. Awesome. Well, it looks like we have some folks spread across the country, which is always exciting. Means we get more perspectives for our discussion later on. So very excited to see that folks are joining. Again, we're going to be using Poll Everywhere throughout the presentation, so try not to close this page because we will come back to it. And with that, I'm going to turn it over to my colleague, Becky Abbott, to provide some policy updates to us.
Hi, it's so good to see everyone. As Samantha said, my name is Becky Abbott. I'm the Senior Director of Advocacy, and I really have the pleasure of serving as the Society's primary lobbyist at the federal level. And then I get to work closely with our Health Policy and Advocacy Committee on crafting the Society's advocacy agenda and our policy positions so that we can do this work at both the federal and state level. So it's really great to see you all. Looking forward to the conversation. So I'm going to quickly talk a little bit about what's going on at the federal level. Um, Today here in DC, we find Congress back in session after their August recess and making a mad dash towards September 30th, which is the day that federal funding for federal agencies and their activities expires. So we're closely watching that to see if the House and the Senate can come to an agreement. I have my money on they will. A shutdown isn't a good look going into an election, but stranger things have happened. So we continue to watch that closely and advocate for our priorities to be included in any final packages. But after they figure out what to do with federal funding, they're going to then head back to their districts for about 6 weeks, and where they'll be campaigning until the election day. And then after that, we'll have a lame duck session. And so that's kind of the state of play in Washington, D.C. Everyone's pretty focused on the federal elections and just trying to get the bare minimum done before then. Next slide. In fact, Congress has been getting the bare minimum done all year long. We have seen in only 80 bills sent to the president's desk for signature in this 2-year congressional session to date. Usually there's been hundreds. It's just been really hard to get legislation passed this year in a divided Congress and with the political rancor that we've been seeing. We've been working to see victories where we can. We were excited to see the Maternal and Child Health Prevention Act pass, which is not a big bill, but one that just encourages states to focus on stillbirth prevention and their public health activities that are funded by the federal government. And we continue to see steady progress on our work to advance the inclusion of pregnant and lactating people in clinical trials. So in the fiscal year 24 appropriations bills, we were able to get some new funding to continue that work at NICHD, or the National Institute of Child Health and Human Development. And we are looking forward to continuing that in future years as well. There was less money overall in the pot for federal funds for health this year, but we were able to secure flat funding for most maternal health programs, and then a small increase for the Improve initiative at NIH. So when some programs saw decreases, we take flat funding as a win. So that's what we've been focusing on over the last year, or the beginning of this year. And next slide, we can talk a little bit about what we're focused on in the lame duck session going forward. As I said, Congress is working towards their appropriations bills. We anticipate a CR, which is just kind of a continuation of funding, no policy included in that. But they will eventually have to pass a spending bill, and within that, we're focused on a couple of things: advancing those maternal therapeutics provisions that we've been championing over the past several years. And then also there was a proposal in the House bill that would reorganize NIH, collapsing many of the institutes and centers into larger institutes and centers. And we've been really focused on pushing back on that, encouraging the process through regular ordering, highlighting the importance of the NICHD and also maternal health funding in general within that reorganization process. So happy to, if you want more information about that, happy to provide it. We're also pushing for authorization bills to be passed, including the Preventing Maternal Deaths Act, which is the bill that authorizes funding for MMRCs that go through the CDC and then flow down to the states. The Shine for Autumn Act, which is another stillbirth bill that we're hoping to enact. And then the Preemie Reauthorization Act, which is really focused on research around preventing preterm birth, and then prevention activities as well. So those are the things that we're hoping to get in any year-end package. But the fate of those is largely dependent on the election, which we'll talk about in a little bit. So while Congress hasn't been doing a lot, next slide, the administration has chugged away at their work as part of their blueprint for addressing the maternal health crisis, which they put out early in their administration. Next slide, please. We've seen a lot of work out of CMS over the past year. Two things I want to point out specifically. There was a new proposed rule that the comment process just closed, and anything that was in that rule would become final in the new calendar year. And so one of the things in there was a set of proposals around minimum standards for hospitals or critical access hospitals that provide obstetrical services. So there were, they're called conditions of participation. And so in order to receive your Medicare funding or your Medicaid funding, you have to meet those minimum standards. And so there were proposed new standards around staffing and training for OB units, also around requiring quality improvement initiatives and data collection, specifically in OB. Hospitals have to do that, but they don't have to do it in OB. This would require them to have an OB quality improvement project and related data collection. There's also some new requirements around OB readiness in the emergency department, and also around having transfer protocols to transfer OB patients to a higher level facility. So we commented on those and really encouraged them to continue to look at maternal health, but really create a glide path or a phased implementation plan for those. So we can provide more information if you need it. The other thing I wanted to flag is that CMS put out this new Transforming Maternal Health model, which is a 10-year demonstration project that they hope to fund states to really relook at their how they're providing maternity care through their Medicaid program. And so with a real specific focus on birth centers, midwives, and doulas. So we are watching this carefully. Many states are applying. The deadline is the 20th, so Friday of this week, and then hoping that you all can help engage with states if and when they get these awards to ensure that the needs of your patients, high-risk patients, are included as they develop these new models. Next slide. We also have seen movement toward the White House Initiative on Women's Health Research, so some new funding out of PCORI and some new funding out of the agency that's focused, the new agency, ARPA-H, I apologize, ARPA-H, that's focused on maternal health, but really until Congress provides some new money for this initiative, there's not a lot that you're going to see happening there, but we continue to monitor. And finally, wanted to quickly flag some of the new actions on maternal health or reproductive health. Next slide. So we've seen them, the administration propose some new reproductive health data privacy rules. So enabling if folks come out of state to receive abortion care, enabling the information from flowing back to other states so they could be prosecuted when they return home. Those rules have actually just been challenged by Texas, but until that moves through the courts, they are still in place and are still there. And if you'd like some more information about that, happy to provide it. And then also the administration's been focusing on EMTALA enforcement. So they've created a new web page for folks to report violations and really focused on getting that information out to states, consumers, and providers. Next slide. And I'll quickly follow up with some Supreme Court updates for those of you that weren't paying close attention at the end of June. There were two court cases that were decided around reproductive health. The first was the Alliance for Hippocratic Medicine versus FDA, which focused on access to mifepristone. The court ruled in that the plaintiffs that brought the case didn't have standing. They weren't harmed by the rules that were coming out of FDA, and so they dismissed the case on standing. And so that was a win. Mifepristone still remains on the market and available, but we do anticipate that folks that feel they have a stronger standing, specifically some states that have shown willingness to sue, will bring that case back again, and mifepristone will continue to be under scrutiny within the federal courts. But for now, mifepristone is available and we'll continue to monitor and submit briefs when possible. Another case that is in a similar kind of space is Idaho v. United States, was really focused on enforcement of EMTALA. As you all know, EMTALA requires hospitals that receive Medicare funding to provide stabilizing treatment to any patient that comes in, regardless of their ability to pay. After the Dobbs decision, the administration put out some guidance that just reminded hospitals of their obligations under EMTALA and said when state statutes conflict with EMTALA, and say that providing abortion care would violate that standard of stabilization, that EMTALA is the presiding law, and you have to provide that stabilizing treatment regardless of bans. So Idaho's laws only provide for abortions in the case when the mother's life is at risk, not her health. And so the federal government sued. It went through the courts, and the Supreme Court initially decided to dismiss the case. They not on its merits, only that it wasn't ready for them to review. So we anticipate that the case will go back down to the lower courts, continue to work their ways up, and we'll see it at the Supreme Court again. So that's kind of the things that we've been watching at the Supreme Court. We work very closely with ACOG and the American Medical Association and file briefs in cases around the country, including these. And so continue to watch them. And I thank you for your time. Happy to answer any questions now in the chat or at the end of the program. And I'll turn it over to Samantha.
Thanks, Becky. So I'm going to take a few minutes now to talk about some state policy updates. As of today, only a handful of states are in session, and even though we still have about 3.5 months left of the year, many states are already gearing up for 2025 sessions. So far this year, SMFM has tracked nearly 400 bills related to perinatal health, over 200 of which were newly introduced in 2024. The others were introduced in 2023 and carried over into this year. And you can see that the state with the most bills introduced this year that we were tracking is New York. Of the bills SMFM has tracked in the perinatal health space, nearly 100 were enacted. And so I'll just run through some highlights. So at least 3 states passed legislation impacting Medicaid coverage. So Idaho and Iowa finally expanded to 12 months postpartum Medicaid, although Iowa also lowered eligibility for pregnant and postpartum coverage. Meanwhile, Washington State increased eligibility for pregnant and postpartum Medicaid coverage, I believe, to 210%, the federal poverty limit. Idaho, Oklahoma, Tennessee, and Virginia were among states that passed legislation addressing maternal mortality review committees, either adding members, reducing members, or ensuring that state agencies had the charge to do these reviews. Other legislation includes one bill in Colorado, which established a telehealth remote monitoring grant to cover services for rural counties and areas with designated provider shortages. In Kentucky, there was a bill that established the Kentucky Maternal Psychiatry Access Program, or the Kentucky Lifeline for Moms, which addresses mental health needs of postpartum patients with mental illness or intellectual disabilities. In Louisiana, a law passed that requires insurance coverage of pregnancy-related services, specifically nutrition counseling and lactation support. We had the Maryland Health Act of 2024, which established new requirements for local health departments, providers, and facilities around maternal health. And a bill in Illinois requires insurance coverage of mental health and substance use disorder services for individuals experiencing miscarriage or stillbirth. We have also been tracking bills related to abortion care, and this year, I believe we've tracked over 800 bills, over half of which were introduced in 2024. Of the bills we tracked, 30 were enacted, and I'll go through some of these bills along with other updates to abortion care in the states. So if you've read or watched the news at all this year, you know that 2024 had no shortage of restrictions and bans on abortion care. Out of Florida, the state Supreme Court finally ruled on their 15-week ban, upholding it, and then allowing a 6-week ban to go into effect this past May. Additionally, the Iowa Supreme Court lifted an injunction from a lower court on the state's 6-week ban, making it go effect, I believe, 21 days later. In Tennessee, legislators passed a bill on abortion trafficking of a minor, which was modeled after legislation that passed in Idaho last year. Similar bills were also introduced in Alabama, Mississippi, and Oklahoma, although they did not pass before those states' sessions ended. And over in Louisiana, doctors are currently preparing for a new law that reschedules misoprostol as a controlled substance. Additionally, several states with existing restrictions, including Oklahoma, Tennessee, and Texas, have lost Title X funding for violating the requirement around providing referrals for abortion care. But with these restrictions and setbacks, we've also seen some wins. The Indiana Department of Health announced that they will no longer release individual terminated pregnancy reports, concerned that doing so could violate patient confidentiality. Over in Arizona, the 1864 ban on abortion was appealed, increasing access to abortion care to 15 weeks, while Maine passed a bill affirming the legal right to access reproductive health services, including abortion and gender-affirming care. Both Rhode Island and Virginia passed SHIELD laws this year, protecting clinicians who provide care to patients traveling from states with bans. And Virginia also passed a law prohibiting the Board of Medicine from taking disciplinary action against a physician who receives or provides abortion care that is not prohibited under state law. Over in Illinois, a new law passed that requires insurance policies with pregnancy-related benefits to also cover abortion care. And a Michigan Court of Claims granted a preliminary injunction blocking the state's 24-hour waiting period. And recently, I believe in the last 2 weeks, a judge in North Dakota vacated the state's abortion ban, ruling it unconstitutional. In addition to legislation and litigation impacting abortion care, we've seen a major uptick in efforts to amend state constitutions when it comes to legislative involvement in abortion care. There are currently 11 ballot measures impacting abortion care access across 10 states, with 2 conflicting measures in Nebraska. And we'll get into a bit more detail later when we talk about elections. Before I turn it back over to Becky to talk about federal elections, I want to remind everyone that you can track this pending legislation in your state alongside us by going to smfmadvocates.org. And turning it over to Becky.
Thanks so much, Samantha. I am going to talk very briefly about federal elections, but as I said earlier, what happens in the next couple of months will really impact what happens in the lame duck session of Congress with federal funding and other priorities, but really over the next 2 to 4 years at the federal level. And so we're monitoring closely. Next slide. So quickly, what's happening in the Senate? The Senate is controlled currently by Democrats by a slim majority. The pundits that track this closely anticipate that the control of the Senate will flip. It's a favorable map for Republicans this year and will be controlled by Republicans, although that's certainly not guaranteed. And there are some pretty tough fights going on currently right now in states like Montana and Ohio, but also Pennsylvania, Michigan, Wisconsin, Arizona, and Nevada. If you've ever even maybe thought about giving to a political candidate, I'm sure your phone is full of text messages like mine, and those states might sound familiar with those begs for money. But we are watching these races closely so that we know how to pivot in the coming months. Next slide. The House is definitely up for grabs as well. And I would say that what happens at the presidential level is highly likely to impact both the Senate races, but certainly what happens in the House. Currently, the House is controlled by Republicans, but with a very slim majority. There's folks that estimate that Democrats might pick up control, and certainly if it's a Harris-Walz win, that could be what happens. But really, those are some close races, and we continue to watch that as well. Next slide. This is from the Cook Political Report, and mirrors what I'm sure you guys have seen, that the presidential race is very, very close and too close to call at this point. And so we see there solid Democrats in the electoral college, solid Republicans, but then that big swath in the middle is undecided, and where the candidates are both focusing right now. We have talked a little bit about the Health Policy and Advocacy Committee about what the two kind of a Republican or a Democratic administration means for us. We anticipate playing a lot of defense, especially on reproductive health, if there's a Republican administration, both legislatively and within the administrative process. If there is a Democratic administration, we anticipate similar efforts that have been going on in recent years, which I described just a moment ago. But we would expect that to be even heightened given Vice President Harris's interest in maternal health. So we'll continue to watch closely, and we'll talk a little bit about how you can contribute here in a bit. Samantha, I'll turn it back to you.
Thanks, Becky. Now, while state and local elections are obviously critical, we're not going to go through each state one by one because we would be here all day. Instead, I want to take a few minutes to talk through the ballot measures that will impact abortion care that were mentioned earlier. So as I said, there are 11 measures across 10 states. 10 of these measures are protective, while one would remove protections. And among the protective measures, some would fully protect abortion care, while others would still allow for a level of legislative interference, especially later in pregnancy. So the following slides are based on fact sheets that we created for our Get at the Vote page, which we'll link shortly. So let's take a look. First up, we have Arizona, which currently has a 15-week ban with exceptions for the health and life of the pregnant person. Arizona also has a 24-hour waiting period between mandatory counseling and care, a mandatory ultrasound requirement, and a ban on the use of Medicaid coverage for abortion care, as well as a parental consent requirement. So Arizonans will vote on the Arizona Abortion Access Act, or Proposition 131, which would establish protections for abortion care up until fetal viability as determined by clinicians. There would also be exceptions for the life of the pregnant person beyond this viability cutoff. Colorado also has a ballot measure this November, and a reminder that abortion care is not restricted based on gestational age, and there is no waiting period in Colorado. However, state Medicaid coverage of abortion care is banned, and parental notice is required for minors. So voters will decide on Proposition 89, which would provide constitutional protections for abortion care and also allow state insurance to cover abortion care. In Florida, abortion care is banned at 6 weeks with exceptions for the life and health of the pregnant patients, lethal fetal anomalies, and rape and incest. There's also a 24-hour waiting period, mandatory ultrasound requirement, a ban on state Medicaid coverage, and a parental consent requirement. The ballot measure in Florida, Amendment 4, would provide constitutional protections for abortion care up until fetal viability as determined by clinicians. Over to Maryland, where abortion care is largely protected, as there are no gestational limits, no waiting periods or mandatory counseling, and no ban on Medicaid coverage of abortion care. Though there is a parental notice requirement, abortion care providers can waive this requirement on a case-by-case basis. Folks in Maryland will be voting on the Right to Reproductive Freedom Amendment, which would enshrine reproductive freedom, including abortion care, in the state constitution. So I don't know if folks recall from the last several months, even in late 2023, Missouri had a few ballot initiatives that were competing. A quick reminder, in Missouri, abortion care is completely banned without exceptions, only an affirmative defense clause. There is a 72-hour waiting period, mandatory ultrasound and parental consent requirements, and a ban on all insurance coverage of abortion care. So that includes state Medicaid as well as private insurance. So the ballot measure that won out is the Right to Reproductive Freedom Amendment, which would provide constitutional protections for abortion care up until fetal viability, with exceptions to save the life, physical, or mental health of the pregnant patient. In Montana, voters will decide on a constitutional initiative, which would establish the constitutional right to abortion care until viability, with exceptions for the life and health of the pregnant patient. Currently, abortion care is banned after fetal viability with no waiting period or mandatory counseling, and state Medicaid funds can cover abortion. Moving on to Nebraska. So abortion care is currently banned at 12 weeks with a 24-hour waiting period between mandatory counseling and care. Additionally, all insurance coverage is banned with limited exceptions, and parental consent is required for minors. Now, Nebraska has two measures that will be on the ballot. The first would establish protections for abortion care up until fetal viability, and the second would ban abortion care in the second and third trimesters with exceptions for medical emergencies, rape, and incest. So we have 3 more states with ballot measures. Next is Nevada, where abortion care is banned at 24 weeks with no exceptions after that, or with some exceptions after that point, my apologies. And there's no waiting period or parental consent or notice requirement. So on election day, folks in Nevada will vote on the Right to Reproductive Freedom Act, which would protect abortion care until fetal viability with exceptions for the life and health of the pregnant person. New Yorkers will also vote on the Equal Rights Amendment, which would establish constitutional protections for a whole slew of things, including reproductive health care and autonomy, which is assumed to include abortion care, although the word abortion is not included in the measure itself. Currently, abortion care in New York is banned at fetal viability, and there is no waiting period or parental notice or consent requirement, and state Medicaid also covers abortion care in New York. And the last state with the ballot measure on abortion care is South Dakota. So currently, abortion care is completely banned with exceptions to save the pregnant person's life. And there is also a 72-hour waiting period, a ban on state Medicaid coverage, and a parental notice requirement. And so Constitutional Amendment G would prohibit state regulation of abortion care in the first trimester, limit state regulations in the second trimester, and allow regulations and even prohibition in the third. I will say South Dakota and a few other states, their ballot measures have been in the courts a lot. And so it's likely that some of these actually won't make it to the ballot. Last I heard, South Dakota, it was very likely it would not end up on the ballot. So it's important to keep an eye out in the news to see what's happening. And until it's decided that these aren't on the ballot, to make sure folks know what each measure means. And so even if you're not in one of these 10 states, there is still a lot that you can do to advocate for reproductive health and perinatal health in your state. So first and foremost, we suggest going over to our Get Out the Vote landing page, either using the QR code or the link on your screen. Again, it's smfmadvocates.org/GOTV. Our campaign includes resources to help you check your registration or register to vote. You can request a mail-in ballot and even more. We have a one-pager on civic engagement along with the one-pagers for the states with ballot measures. Additionally, we've partnered with Vote ER this year. Vote ER is a nonpartisan, nonprofit organization dedicated to revolutionizing voter engagement by transforming routine healthcare visits into opportunities for civic empowerment, partnering with trusted healthcare professionals, and reaching historically underrepresented communities. So by using the QR code that we previously had up or going to our Get Out the Vote website, you can request a free badge from Vote ER to help encourage your patients to register to vote. You can learn more about Vote ER and our Get Out the Vote efforts by rewatching our joint webinar with Vote ER from June, where attendees learned how to talk with patients and colleagues about voter registration and more. Also, since y'all are always on the go and working nonstop, we also recommend you listen to our Get Out the Vote episode of the SMFM podcast, where Dr. Heidi Leftwig interviews Doctors Priyanka Gore and Maria Phyllis about the importance of civic engagement, especially when it comes to access to healthcare. So I'm going to put this QR code on the screen one more time so that folks can go to our Get Out the Vote website and learn more and hopefully access a Vote ER badge if you haven't already. So before we open it up for discussion, we just have a couple more questions. So if everyone could open up that Poll Everywhere link, and I've also included the QR code and link here as well. Okay, first and foremost, we just want to know, are you registered to vote? It's anonymous, so if the answer is no, no one will know it's you. But I'm loving that the yes is a 100%. Even for folks who know they're registered, I still suggest going to our Get Out the Vote page and checking your registration, especially if you live in a state with stricter voting laws. Sometimes voter rolls are purged, and so it's important to just confirm that you can vote so that you don't show up on election day and are turned away. And our last question before our discussion, have you ordered your Vote ER badge? You'll see that there's no answer, and that's because we encourage everyone if you haven't yet, to go and order it. You can get it on our Get Out the Vote website again, smfmadvocates.org/GOTV. It's completely free, it's nonpartisan, and it's just a great way to talk to patients and colleagues about the importance of civic engagement so that every voice is heard. And with that, I'm going to stop recording as we move into our presentation. If I can find the record button.